Welcome to DermWire News, powered by DermWire.com.
Skyrizi gets FDA approval, Brooke Shields endorses Sculpture, and the Noah Worcester Society hosts another successful meeting.
We had a lot of good interaction, good discussion, and this is a good place to hang out with your fellow colleagues and learn a lot.
Ahead on DermWire TV. Welcome to DermWire TV from the editors of Practical Dermatology magazine. I'm your host, Rana Jaraha. Skyrizi, an interleukin-23 inhibitor from AbbVie, is FDA approved for the treatment of moderate to severe plaque psoriasis in adults who are candidates for systemic therapy or phototherapy. In clinical trials, Skyrizi produced high rates of durable skin clearance, with 82 and 81% of treated patients in 2 trials, respectively, achieving PASI 90 at 1 year. 56 and 60% of treated subjects, respectively, achieved complete skin clearance or PASI 100. The recommended dose for Skyrizi is 150 milligrams administered by 2 subcutaneous injections every 12 weeks following 2 initiation doses at week 0 and 4. Skyrizi can be administered in office or by self-injection after training. An integrated analysis of data showed most people treated with Skyrizi who achieved PASI 90 and PASI 100 at week 16 maintained this response at 1 year. The frequency of adverse events through 1 year was similar to events observed during the first 16 weeks. Dermatologist Dr. Kenneth B. Gordon, a principal investigator for the Ultima I pivotal trial, noted in a statement that he is pleased the dermatology community now has a new option that can help patients achieve and maintain a high level of treatment response. She's a model, film actress, Broadway star, author, and now celebrity spokesperson for Sculpture. Brooke Shields is the face of the new Be Strong, Be Sexy, Be Confident campaign for the energy-based device. Sculpture from Hologic Cynosure is non-invasive, light-based treatment that targets and permanently destroys fat cells in the treated area. Ms. Shields has admitted to struggling with body confidence. In a statement, she says, "I chose Sculpture treatments because I was looking for a body contouring option that complements the hard work I put in every day, and I want to inspire others to feel beautiful and confident." As part of the new campaign, patients can enter to win 2 free Sculpture treatments and a trip to New York City to meet Brooke Shields. Details are at sculpture.com. The Noah Worcester Dermatological Society annual meeting brought members to Palm Springs, California for its 61st annual meeting. DermWire TV caught up with presenters for updates on the latest information from the meeting.
What I did in the talk was actually go over 4 particular reasons or the backing behind getting patients to complete clearance. The first one focused on quality of life. We have quality of life data now to suggest that complete clearance gives the best quality of life for patients, even compared to a little bit of psoriasis, which takes a hit on quality of life. So the quality of life data is very strong in this regard. The second issue is on cardiovascular disease. There's emerging data now to suggest that the more we can achieve complete skin clearance, the better chance of decreasing aortic inflammation, systemic inflammation, and the risk of heart attack and stroke. So more skin clearance, more better systemic inflammation outcomes. Thirdly, there's guidelines that have come out in recent years, specifically the National Psoriasis Foundation has really put forth the idea that all of our patients should be at a body surface area of 1% or less. So that is the recommendation these days, the modern recommendations for treating psoriasis, to get patients at a very low level to zero skin disease. And then lastly, I highlighted the fact that we have the tools now in our toolbox, the outstanding agents that can give us 100% clearance.
I talked about the PLA study and how clinicians use this test in a large trial. We looked at how clinicians interpret the test and act on it. This is a test of looking at PLA and link gene markers in the examination of pigmented lesions. And clinicians were found to be using the test appropriately, biopsying those lesions that were positive for the gene expression profiling These gene expression profiling tests that were positive for both LINC and PRAME demonstrated 93% concordance with melanoma, 50% if there was they were PRAME positive, and 7% if they were only LINC positive. And these tests were used by clinicians to determine if a lesion should be biopsied. And what we found was that clinicians are using the test appropriately. They've decreased the number of biopsies when they use the PLA test, also decreasing the number of excisions.
We invited 2 young residents to present their research at our meeting. Aislinn Nelson from the University of California and Allison Cruz from the University of Mississippi Medical Center were the awardees this year. It has really made our meeting special by having young people with a chance to present their research and new ideas.
The 62nd annual meeting convenes next May in Newport, Rhode Island. Dr. Robert T. Brodell is an American Academy of Dermatology patient care hero, recognized for working with colleagues at the University of Mississippi Medical Center in Oxford to open a dermatology clinic in the Delta, an area of the state that previously did not have a dermatologist for nearly 100 miles. Through a collaboration with an existing medical clinic in a Delta high school classroom, Dr. Brodell and colleagues now offer dermatology services to patients every 2 weeks. That's it for this edition of DermWire TV. You can also get news updates anytime at practicaldermatology.com or by enabling the dermatology news skill for Echo devices. Thank you for watching.
Thank you for listening to DermWire News.